I would like to please enjoy your food, and we'll take this little time while you're eating to familiarize you with what we've been doing in trying to understand what the co-op is and how we can develop it and how that will help everybody's practice. And I have, if somebody can click that slide onto, not this accountable care organization, but the one before it on the healthcare. And I'm not going to read these slides to you. They're in your book, but I want to tell you what it's about so you'll understand how we got there. Yeah. What we did is, the co-op is a pretty simple idea. It's just derived from what you saw in the film earlier, from what other co-ops have done in the country, and that is people coming together and winding up getting health care, not health insurance, but getting health care, and then making an alignment with physicians after they came together so they could pay for it and they could get health care. But we didn't know how to go about it. I mean, we knew that was a fairly simple idea, and then the idea of concierge medicine, where physicians, some of them said, look, I'm tired of dealing with insurance. I don't want that anymore. I would just like to deal with my patients and get paid for services when they come up. And then so they come up with a monthly fee that patients pay them to get access to their practice and to get special care. Well, most of those ideas are good ideas. The problem with the concierge medicine is they were appealing only to those people who had a lot of money, and that's what they were trying to do. And so the prices that were set by physicians for concierge medicine were in the range of $100 to $200 a month. And so a lot of patients, even patients who could pay that, wouldn't do it. It was expensive, and they just wouldn't do it because they look back at the bills they paid in the past, paying cash for medical services when they got them, and they never spend more than $300 or $400 a year for primary care. And if you look at a primary care physician's practice, that's what they average per patient per year. It's about somewhere between $20 and $40 a month, sometimes more, but they're usually doing more than primary care when they're making more than that per patient per month. So we decided, well, let's ask patients. Let's start at the beginning. If the money that is paying for medical care is coming from the patients, how much are they willing to pay? And how frequently are they willing to pay it? So we started interviewing people. We called them on the telephone, and we talked to 4,000 people, and we did it over a period of about 4 months. And then, of those 4,000, we invited them to come to a little seminar so we could practice making a presentation to them about our idea. And we had 350 people that came to the seminar, and we spoke to them way longer than we needed to and watched to see how they would react to what we were saying and whether they took it positively or negatively, and what things we said helped them understand and what things we said confused them. Well, that's Dr. Reddy that just came in. He's one of our partners and big supporters, and has been around and very experienced physician from California in cardiology, and was chief of staff over at the hospital in Baytown, San Jacinto Methodist, and I'm just trying to embarrass him while he's here. But what we did as a consequence of that survey of those 4,000 people and those 350 surveys is we came up with a presentation that is effective in talking to patients. And the first thing that we found out, and you'll see here, is that the survey, what they're interested in, the reasons they didn't have insurance or participate, you'll see in that second slide. 6 out of 10 people that we interviewed didn't have insurance. Now, the public statistics on that in Texas is that 25% of the people are without insurance. But we couldn't find all those other people between 25 and 60 that were insured. So we didn't know where the state gets their information or the federal government gets their information. But when we talked to 4,000 people, 6 out of 10 didn't have insurance. I have no good reason for understanding that, but they don't. Now, why? They said, well, it costs too much, and they didn't qualify for pre-existing conditions, or they just didn't trust anybody. So they didn't buy it. And then the people that had insurance, this was even worse. But it's understandable if you think about it yourself, about your own experience. 9 out of the 10 people thought they had coverage that they didn't have. They thought they had, oh, I got full coverage. I pay a lot of money. I pay $500 or $600 a month for me. So I got everything. When I go to the doctor, it's covered. That's what they thought. But the fact was that they usually had high deductibles, or what they had was not covered because of some pre-existing condition, or the rates that the carrier was paying was out of network rates were only half of what the in-network rates, and they were going out of network. So even the people that had insurance didn't know what they had. So that meant that we had to tell them something about insurance before we could even talk to them about the co-op. They had to understand what they were getting and what they had. We had to destroy their notions that they had something that they didn't have. Now, if you have an automobile insurance policy, I bet you all do, or you have a fire insurance policy on your house, and I give you a quiz today on what's covered in that policy, you'll fail, right? Because you're not going to read that 25 pages of small print in those policies to figure out what that coverage is. You know about it when something happens, when you have an automobile accident or when you have a fire. That's when you know what you're covered by. You know it from experience, and it's always negative experience. So it's not unusual to find in a survey like this that most people don't know what they have, and they don't know what their health insurance is. And they've trusted their employer, if it's a large employer, to look after that and make sure that they have enough to make them happy. Now we have Mike Alexander here, who's one of our field marketing organizations, and he has been doing this for 30 years, and I'm sure he'll stand up and testify that that's true, that almost everybody he talks to, whether they're an employer or an employee, have no earthly idea what they have. And certainly the only thing they know for sure is that they pay a lot for it. All right, from that, we had to tell people very basic, very simple things, like if you get health care, forget insurance. If you're getting health care, what kind of health care is there? Well, eat right, keep fit, and get checkups. Do some preventive stuff. Well, they say, well, that's not even covered by my insurance. Some insurance policies nowadays are pretending to point in that direction, saying that we're going to let you go to the primary care doctor in spite of the fact that you have a big deductible on your policy. You'll just have a small copayment of $25 or $35 if you go to the primary care, and that's so that you can eat right, keep fit, and get checkups. So that's a kind of health care. For the co-op, that's important because it's a really important part of what the co-op is doing. We're trying to make it so that the patients and the physicians are together at the times when they're not sick, when something can be detected early and can be taken care of when it's less complicated. That's what the whole point of a co-op is to get the patient and physician together financially and physically so that they can take care of things before they become a crisis. Then the next thing is the primary care for sicknesses and accidents, or I guess acute care. And you diagnose and treat problems and control diseases and do care coordination. And that's what primary care does, and some of the specialists do the same thing. And then the tertiary stuff, the specialty care, where we do surgeries and complicated treatments and diagnosis and hospitalizations and rehabilitation. So when you do those three things and the patient understands, oh, I understand that, the insurance comes in for people when they get to that third thing most of the time, because they can usually pay for preventive and primary care out of their pocket, but they can almost never pay for the specialty care and the hospitalizations out of their pocket, and they need insurance to take care of that. Or they need some sort of financial plan that's going to come into play when those things happen. All right. Typically, insurance companies have high deductibles and high co-insurance and co-payments. The co-payments is a new thing to try to bring preventive care and primary care into play when people have policies that don't cover very much. These are examples of what the major insurance companies would charge a young family with 2 children. Those are typical rates with high deductibles. The lowest one being $1,500, but it's still $818 a month for that family. Were this family over 45 years old, that rate would not be $818, it would be $2,000. And the rate for insurance is going up at a rate of 16% every quarter. It's not going anywhere except that direction. And I'll let Mike testify to that too, because he sees that all the time. Now look, what happens? We had our insurance company that we made a contract with design a health insurance policy that matched the contracts that we had with the physicians and hospital. And then it's a little mini policy. It only covers $25,000 for any expenses for any patient during a year, but it covers it from the first dollar. So it pays where the money is really being spent. And when you compare it with the best policy that we could look up, the Blue Cross Blue Shield policy, and you have a claim for hospitalization and a surgery and physician office visits for the primary care and specialist, our little mini policy beats Blue Cross's big unlimited policy by 25% in benefits. The claims there's more claims the patient is paying less out of pocket, and they're paying less in premium for that family. Now you can get $1 million limit, you can raise this up and raise the premium, but the relationship of savings stays the same. Now, let's say you don't have any hospitalization, it's just routine care. If it's just routine care, the savings is it's 26% because you don't have any out of pocket for primary care, and the difference is just the premium. All right. Now, what are we doing? We're telling each other, the patient and the physician, that we're in this together. We're a nonprofit and we're in it together. It's mutual support for healthcare.